This is February 2020 from the COVID-19 timeline. I have to say that I'm really impressed with and appreciative of the work that Mike in Canada has done on this series. It's really a great series because I don't think there's anything like it, for starters, out there. We have a lot of coverage of the event as it unfolded, but there is so much commentary and reaction and spin and bias. And so what Mike has given us is an opportunity to go back and see this event as it unfolded in the media. And there is no comment. So February 2020, enjoy.
Beginning at 5 p.m. Eastern Standard Time, Sunday, February the 2nd, the United States government will implement temporary measures to increase our abilities to detect and contain the coronavirus.
Among those measures, foreign nationals who visited any part of China in the last 2 weeks will be barred from entering the United States. And any U.S. citizen who's been to the epicenter will face a mandatory 14-day quarantine, including the 195 U.S. citizens evacuated from Wuhan, now being held in mandatory quarantine at March Air Reserve Base.
World health officials this morning are reporting the first coronavirus death outside of China. A man from Wuhan, China, has died in the Philippines. In response, the Philippines has banned travelers from China. Meanwhile, the 8th coronavirus case here in the U.S. was reported in Massachusetts. Hundreds of people who traveled from Wuhan remain quarantined in California this morning.
A local farmer tends to his crops when he crosses the path with one of China's most adorable animals, the masked palm civet. A weasel-like animal, the masked palm civet is unique to Southeast Asia. And to this farmer, though, this close encounter with this particular civet has become a deadly one. As the farmer breathes in the fresh fall air, a few stray particles work his way into his lungs. Hiding amongst the farmer will be dead in a matter of days, his corpse laid up in the same hospital bed he checked himself into after having extreme difficulties breathing. The virus within him, however, remained very much alive, even as doctors inspected his corpse for a cause of death and remained unable to identify one, other than mysterious acute respiratory. Death toll, however, continued to rise, and slowly Canada's Global Public Health Intelligence Network, a global monitoring system that scours media for possible pandemic outbreaks in order to stop them in their tracks, gathers evidence that something is very wrong and happening on the other side of the Chinese media blackout.
At the epicenter of the coronavirus outbreak, long lines to get into a hospital in Wuhan, China. The number of confirmed cases now approaching 24,000, nearly 500 fatalities. Tonight, the first American confirmed to have coronavirus in China is being treated in Wuhan, while in the United States, still 11 confirmed cases. In Riverside, California, an infant has been hospitalized with a fever out of an abundance of caution. Among the 195 Americans evacuated from China last week under quarantine for 14 days. Also tonight, another plane full of stranded Americans is headed to a U.S. base.
What's different about novel coronavirus is that we don't know a lot about it yet, and we don't have a vaccine. And so our methods to prevent it are more limited.
I'm Molly Hunter in Hong Kong. For passengers on 2 cruise ships, it's total lockdown. At the Japanese port of Yokohama, 3,711 people, including 428 Americans, are quarantined on the Diamond Princess.
We have to be quarantined for 14 days.
10 confirmed cases on board, including 1 American, now all in the hospital.
If you've been following how Wuhan has been dealing with the coronavirus outbreak, you may have noticed impressive footage of hospitals being built in record time. Construction started in late January, and the government said hospitals would be ready by early February. Tens of thousands of state-owned employees, as well as military personnel, have poured into the city. They are in a race to pull off this task. In under 2 weeks, one of the hospitals was declared completed and began admitting patients.
Because this is a virus, antibiotics have really no role in this. There aren't any specific antivirals for this coronavirus at the moment, but people are working on it. So please don't ask for antibiotics. They waste our resources, they waste our time, and don't add anything except breed resistance in germs that we can tackle.
As the Chinese government scrambles to contain the virus, the U.S. Embassy in Beijing confirms the first American death, a 60-year-old who died in Wuhan. Meanwhile, flights carrying more Americans from Wuhan arrived in the U.S. last night, and passengers are quarantined at military bases in California, Texas, and Nebraska. The State Department says a total of 800 Americans have been evacuated from the city so far, and no additional flights are planned.
Tonight, a crucial test in China's biggest cities that have been in virtual lockdown to keep the coronavirus from spreading. People are still taking a lot of precautions. The streets here are unusually quiet. It's a city of 23 million people. It's like small town traffic. But now, millions set to return to work as the death toll surpasses the SARS outbreak that killed 774 people worldwide. The infection rate for this outbreak is much higher. Tonight, extreme measures to contain the virus. In Wuhan, spraying disinfectant on buildings and cars. And videos on social media showing quarantine squads looking for anyone with symptoms. Wow. People being taken away. And what appears to be mass treatment centers. In cities like Beijing, masks and anxiety, the new norm. And temperature checks to buy coffee, ride public transit, or enter a building.
We now have a name for the disease, and it is COVID-19, and I will spell it COVID-19. CO stands for corona, as you know. VI stands for virus, D for disease, so COVID.
It's one of the last scenarios one imagines when booking a cruise vacation, and perhaps one of the most nightmarish. Docked in Yokohama, Japan, the cruise liner Diamond Princess now has the largest cluster of COVID-19 cases outside China. More than 3,000 people remain in isolation on board as the number of confirmed infections continues to rise.
The coronavirus death toll in China dramatically spiked on Thursday. 242 new deaths were reported in Hubei province, the epicenter of the outbreak. This figure is more than double the prior daily record, reported by China's Health Commission. The reason could be because officials have adopted a new way to count infections. But it was not immediately clear how the new methodology changed the results, nor why the death toll suddenly leapt up so high.
Singapore confirmed 9 new cases of COVID-19 today, 6 of which are linked to the cluster from the Grace Assembly of God Church. Now, this brings the total tally here now to 67. The 6 new cases linked to the Grace Assembly of God Church raised the total in the group to 13, and that makes it the largest cluster of locally transmitted cases in Singapore among the 5 that have already been identified. Now, the new case.
France was the first country in Europe to confirm cases of coronavirus. Now it's the first to record a fatality linked to the outbreak. Elsewhere, the World Health Organization has issued a warning about what it sees as a global lack of preparation to deal with a virus like this.
We're concerned by the lack of urgency in funding the response from the international community. The world spends billions of dollars preparing for a terrorist attack, but relatively little preparing for the attack of a virus, which could be far more deadly and far more damaging economically, politically, and socially.
An 83-year-old American passenger has tested positive for COVID-19, the first from this liner. The Westerdam docks in Cambodian port on Thursday with 1,455 passengers and 802 crew. It had been stranded at sea for 2 weeks after being refused by 5 ports from different nations. The Westerdam's operator had said no cases of the virus had been confirmed, and Cambodia agreed to let the ship dock. Country's Prime Minister Hun Sen welcomed the passengers on Friday.
The death toll from the COVID-19 virus outbreak in China has jumped to 1,770, and more than 70,000 people have been infected nationwide. But there is some positive news. The total number of patients who have recovered has passed 10,000, and new cases outside Hubei are declining, while within the province, the fatality rate has dropped.
We'll start off with coronavirus. China is offering the children of medical staff who are battling the outbreak priority placement in schools. We also have new statistics which show medical staff are most at risk of dying from the virus. This cruise ship, moored in Japan, has been under quarantine for 2 weeks now. There are more than 450 people on board who have the virus. As you can see, the crew is doing its best to keep people's spirits up and to keep their spirits up, no doubt.
Some building technique company says all their quarantine rooms were put into use last week. Each one measures 10 square meters, big enough for 2 beds. They meet required standards for heat preservation and isolation, and are designed to withstand strong winds and even earthquakes. The company says they are easy and cheap to make.
A quarantine room can be printed in 2 hours, and one printing machine can produce 15 rooms a day. Its base cost is around 28,000 yuan.
Very mobile and easy to set up. The 3D printed walls can be used as soon as they're connected to electric power. They're easy to disinfect and can be resumed when the epidemic ends.
As far as wearing surgical masks when you're out and about in the public, we just really don't have any data to suggest that that is effective, particularly for something like COVID-19 that's thought to be transmitted by the airborne route.
In South Korea, the number of infections doubled overnight to 200. Nearly all of the cases tied to a secretive church, considered a cult by other local Christians. Health officials say 500 more church members are showing symptoms and may be infected, but many have gone underground.
At this point in time, the probability of getting COVID-19 is extremely remote. I think everyone in class, if everyone were to check their no temperatures with no respiratory symptoms, each takes the responsibility to themselves, then go for the class, go in and enjoy yourself. Let the child be a child.
Jian, the number of COVID-19 related deaths in South Korea tripled in single day of Sunday alone.
Yes, the total number of deaths due to the virus rose from 2 to 6 people in a single day. The third victim was a 41-year-old male who was found dead Friday in his residence in Gyeongju City and was confirmed to have the coronavirus during an examination of his body.
Fighting an invisible enemy. Tonight, the number of COVID-19 cases in the US climbing to 53 after tests confirmed new cases among those former cruise ship passengers. It comes as towns fight plans to move infected patients into isolation in their communities. Frustration boiling over at this city council meeting in Anniston, Alabama.
It spreads from here, it's going to spread everywhere else.
And a judge in California temporarily blocking the state from using a facility for infected patients in Costa Mesa.
Now, across the globe, more cases are surging. France has reported its first citizen death due to the coronavirus. According to the health authorities on Wednesday, the 60-year-old French man died in a Paris hospital, making him the second person to die from the virus in France.
Across the globe, the number of coronavirus cases has topped 80,000. The World Health Organization says the outbreak is now present in more than 30 countries and territories, as seen here. Brazil has become the first South American nation to confirm a case. It marks the spread of COVID-19 to every continent on Earth except Antarctica. Now, outside China, Iran now has the most number of reported deaths. Dozens of new infections are raising fears of it spreading across the Middle East.
And in less than 2 months since patient zero, that number has climbed to more than 80,000 around the world. It's an outbreak so big that people have started using the P word, pandemic.
Time is running out to prevent a global pandemic.
The window to stop coronavirus from turning into a pandemic is closing.
Does this virus have pandemic potential? Absolutely, it has. Are we there yet? From our assessment, not yet.
Unfortunately, one person passed away overnight.
At a Washington State hospital, thousands of miles away from China's coronavirus epicenter, tragic news, the first coronavirus death in the United States.
The person who died was a patient at Evergreen Hospital who had underlying health conditions. It was a male in his 50s.
The CDC says it was likely community spread, meaning the source of infection is unknown and patients have not recently traveled or been exposed to someone confirmed to be at risk. The death, one of 3 new cases in the state, the other 2 also believed to be community spread and happening at a nursing home there where officials now say there may be an outbreak.